Question number 4, Kevin Hague.
Thank you, Mr. Speaker. My question is to the Minister of Health and asks, are there any recommendations from the Public Health Advisory Committee's report on child health, the best start in life, that he will not be implementing? If so, for what reason?
The Honourable Tony Ryle.
Mr. Speaker, I have received that report. I can advise the member that the report and its recommendations are being considered by the Ministry of Health in the development of its child health work planning. It's simply too early to say what recommendations may or may not be implemented at this time.
Kevin Hague.
Supplementary. Does he agree with the report's conclusion that New Zealand's child health outcomes compare poorly internationally, and that these outcomes are low, and I quote, in part because gaps have widened between the health status of different groups in our communities over the past 3 decades? If not, why not?
The Honourable Tony Ryle.
I certainly agree that we can do a lot more to improve the health status of New Zealand children. There is some information that will be coming out in the next couple of weeks which will indicate that some of that variation and that difference between different deprivation groups has been improving in recent times.
Kevin Hague.
Supplementary. Did the Minister raise with his colleague, the Minister of Finance, the OECD report that ranked New Zealand 29th out of 30 countries last year for child health and safety? And if so, why didn't the budget do anything to close the gaps between the haves and the have-nots?
The Honourable Tony Ryle.
Mr. Speaker, I know that the Minister of Finance is aware of that report. In fact, the budget has done quite a lot to improve health services for New Zealand, particularly in the areas of child health. The government remains strongly committed to achieving its vaccination target, as well as other important health goals.
Kevin Hague.
Supplementary, sir. Given the findings of the Public Health Advisory Committee's report, why has his government chosen to prioritise elective surgery for adults over child health services in the community?
The Honourable Tony Ryle.
Well, the government has been investing in both. We certainly are putting money into child health services around the community. One of the government's 6 health targets is lifting the rate of immunisation for young New Zealanders. And for the first time ever, we've got to 85%. And information will be coming out in the next few weeks which will show that people in the lowest deprivation areas have had a significant uplift in that area. The government is also investing in elective surgery strongly. We think it was unacceptable that in the last 9 years the budget doubled and fewer people got service.
Kevin Hague.
Supplementary question. Why has the Minister chosen to ignore the rheumatic fever epidemic in New Zealand children, referred to in the Advisory Committee's report, which sees infection rates 14 times worse than the OECD average, and which disproportionately affect poor Māori and Pacifica children?
Honourable Tony Ryle.
Mr. Speaker, the government does not ignore that information. We've inherited a lot of problems in the health service, and while they might have been ignored under the previous government, they are not under this.
Kevin Hague.
Supplementary, Mr. Speaker, could the Minister explain some of the government's initiatives to tackle rheumatic fever?
The Honourable Tony Ryle.
The government is working assiduously in a number of areas. The changes we are making in primary care, for example, will help in the prevention, and also we've made significant investments in a number of areas, our home insulation program, and also the investment we're making in vaccinations.
Kevin Hague.
Supplementary question. Has the Minister received any advice that the Public Health Advisory Committee's recommended way forward to improve child health and safety is not the best way of doing so? And if so, what was that advice?
The Honourable Tony Ryle.
As the member knows, there are 21 recommendations in that report, and as I indicated earlier on, it is too early to say which of those may or may not be accepted.
Point of order, Mr.
Point
Speaker.
of order, Kevin Hague.
I seek leave of the House to table 2 documents. The first is the report from the Public Health Advisory Committee, The Best Start in Life, Achieving Effective Action on Child Health and Wellbeing. Report
Leave
to the
us
Minister.
to table that document. Is there any objection? There is no objection.
The second, Sir, that I seek leave to table is the report from 2009 from the OECD, Economic Valuation of Environmental Health Risks for Children.
Leave is sought to table that document. Is there any objection? There is no objection. Question number 5, the Honourable Clayton Cosgrove.
Mr. Speaker, my